It's 1:45. We can get started. This is using a remote force for a local health crisis. And Ned Kalapasev from Northern Kentucky Health Department is giving the presentation. Ned, you can take it away.
All righty. Good afternoon, everybody. I am going to go through this relatively quickly. It's not a super elaborate presentation, and I'm hoping it'll be interesting enough because it's not Esri for a change, perhaps, today. I know there's a lot of Esri stuff, and we are an Esri shop, but we ended up going a slightly different route for this. So, Northern Kentucky Health Department, just a brief background on who we are and what we do. We are the local health district for top 4 counties in Northern Kentucky, Boone, Kent, Campbell, and Grant. Our main office is in Florence, so we're by the Florence City Building in that government complex. We are a public health agency in charge of performing the mandated public health services and addressing the community health needs in Northern Kentucky. One of our main jobs or main duties is to prevent disease, promote wellness, and protect against health threats for all the residents of Northern Kentucky. At a glance, as I said, we do 4 counties. We serve 4 counties. We have 5 sites. We have a health center in each county and a district office. One of the big steps for us was to become nationally accredited in 2013. We were one of the first 5 health departments in the entire United States to do this. So out of 2,000 plus health departments. So we're sort of leading the way in that as well. About 150 staff, operating budget about 19 million. And our governance is that we have the main district board of health, and then each county has a local board of health that adds to the governance. As far as the breakdown, we have sort of main divisions: clinical, environmental health, epidemiology, health promotion and administration. Most of our clinical work is done in our clinics. We do some house visits and things like that too. Our environmental staff, health inspectors, restaurants, that kind of stuff. Disaster preparedness folks are housed with those folks. Epidemiology people, very busy these days. And we have the health promotion, which are health educators and sort of community health professionals, and then administration, right? The wheels where everything goes: payroll, purchasing, budget, that kind of stuff. GIS, myself, as well as our informatics and public information are housed under administration. We are tasked with 10 essential public health services. So I'm not going to bore you into too many details on this, but essentially anything that a local health department should do, we do, and we do it well on a recognized on a national scale for that. So I'm going to jump right into it, right? So COVID-19, global pandemic, first cases in the United States in January, first local case in March for our district, March 13th. We basically, as it happened, were gearing up and prepared to address this emerging threat. So on the March 13th, we've declared states of emergency, followed the national and a state move for that, and basically decided to provide our help and services remotely from that point on, right? The point of this was to ensure that we have a workforce still in case this becomes very cumbersome, and if we get sick, who's going to do our work, right? So we made sure we were first to implement that and proceeded with that. So which meant that about roughly 130 people had to start working from home, right? We had emergency plans in place for this, and emergency response duties were reassigned based on the need. And then as the case counts started increasing in Northern Kentucky, more staff was assigned to epidemiological support. Those guys are still super busy and working hard every day to stay ahead of this. So most of the work in epi field is through contact tracking and tracing and data collection, right, and follow-up. So basically, the contact tracing investigation is the backbone of any communicable disease response and investigation. Essentially, what you're doing, you're reaching out to COVID-19 folks that had positive tests and trying to figure out all the people they've been in touch with and what that looks like, and how we can get a better understanding which way the disease may be spreading, right? As the communicable diseases go, we need to make sure to reach out to as many folks that have potentially been exposed and allow them to assess and understand the risks and look for symptoms, and in this case, actually quarantine also. So the call initially involves asking questions from a survey, that information that goes into a database that we monitor, right? A positive case happens. We do a contact tracing. So we sort of create a contact web from that positive case and attempt to find all the close contacts and potential exposure that case have had. Contacts are told what risks are and what they can do to watch out for symptoms, and what symptoms to, if they were to show up, what to do with those. And those that were exposed are also told to quarantine for 14 days and take their daily temps and keep track of that. That all was working pretty good. Excuse me 1 second, folks. I have some technical difficulties here. Okay, can you guys still hear me?
Yeah, we can still hear you.
Okay, I'm sorry about this. 1 second. Okay, I got it. All right, sorry. So as the initial spike happened, March and April, and sort of towards the end of April, people are feeling like, oh, this might be the end of it. Governor and some other powers to be are slowly allowing for partial reopening, and things are trying to kind of go back to normal. The task of capturing people at home became more daunting, right? Prior to this, when people were just sort of hanging at home, it was easy to get a hold of them on a phone and get additional information. What ended up happening is then the contact tracing became more difficult, leaving messages and trying to track people back down and that kind of stuff. So this then also forced us to reconsider the times that you reach people. So folks started working at different shifts, later in the evening, trying to capture people on the weekend at home and that kind of stuff. And so a certain amount of flexibility is also needed on that too. So what we end up doing is we have been using Google Business Suite internally for our mail and email and calendar scheduling and that kind of stuff for a while now. And Google Docs have been sort of integrated into our operating procedure at this point for quite a few years. We really quickly shifted to that, which allowed us to use the web-based cloud solution with no software-related headaches. People just went home with their laptop. They were able to access what they needed to. And additionally, if you think of this, we end up hiring additional folks to help us with contact tracing and that kind of stuff. So that also meant that the new hires and folks there becoming our employees. Even as part-time, they had to adhere to certain policies and complete trainings and things like that. So the onboarding and that kind of stuff became virtual also. And again, all of that is done through Google Business Suite. So in our case, we've used Google Forms to create surveys and forms to interview contacts. And then the data was submitted to a Google Sheet. They're linked, right? So we were able to embed automatic geocoding on form submit if the address was available. If not, we would geocode on the back end once that became available, and use the Google Sheets for storage, aggregation, and staging for reporting. So I'm jumping into data reporting part now, right? So I was trying to kind of lay it all out. So we have multiple folks working different times of day and night from home in different locations, calling people, contact tracing, gathering information over the web browsers, and it's all getting centralized in Google Sheets with no software. So that worked out really good for us from that aspect. There's a fair amount of tools that we were able to do and create sort of a mini staged areas of the Google Sheets for reporting, and then push that out to various softwares or what we need to do with, right, to create reports. So in this case, we've used Tableau to create reports and dashboards for all aspects on the COVID-19 pandemic. We have two main sets, internal reports, looking at probably 12 plus, maybe 15 dashboards at this point, looking at everything from demographic data and clinical data, spatial analysis of some hotspotting, to specific areas based on local needs. For instance, Covington government would like to get a little bit more information, or city manager is interested in this and that. So we were able to kind of create a more focused analysis and messaging depending on a need. Sort of a generalized flow chart of how this turned out to be. And I will show you a couple of examples of at least our public facing dashboard. But what I found very helpful and interesting in this is that in the push to do this, right, and then provide reporting and everything else, I was immediately looking at Esri and their suite of tools. You know, we've done some story maps, we've done some pretty cool stuff with it. There's tons of tools there. It was a little bit cumbersome on my end to do this through Esri, only because of our setup, right? I say we're an Esri shop and we have GIS. In reality, it's really me. It's a one-man show. Sort of 50% of my time is dedicated to GIS and 50% is sort of SQL Server administration. So the workstation that runs, you know, the desktop and that kind of stuff sits in my office. Well, I took my laptop home with me. I was remoting into that. It was kind of crunchy. I was looking at additional things what we can do with this to kind of speed things up. And recently they've taken some Tableau training, and so this kind of came in handy, and I sort of decided to switch gears and address this whole thing through Tableau, which I'm pretty happy with at this point. So in the database work from the Google Sheets, pushing out into reporting staging area, we were able to get multiple different views and different slices of analysis from the same data. So when the underlying data gets updated and pushed, everything else gets updated on the fly pretty swiftly. So I'm very happy with that. Additionally, I did use some Esri to create a testing location finder app. We can look at that in a second. It's also on our website. Points to it, basically just highlights where COVID testing sites are available in Northern Kentucky and what folks can do to do that. But I'm gonna go ahead and bring up the public facing share here. Hit the load. Okay, you guys seeing the website dashboard, correct?
I do not see it. I still see your slide.
Okay, that was my worry that I'm sharing the wrong. Let's see. You still seeing my slide only?
Still just seeing your slide.
Okay, I'm sorry. I need to be in the screen. Okay, here we go.
Yeah, that's it.
All right, my bad. Okay, so this is our public facing reporting side. We have 4 counties, as I said, again, and trying to provide as much information to different groups of folks that might be interested in this. So media, right? Local officials, general public, they all have a slightly different need. Trying to kind of come up with a report that includes as much of it as possible, right? We just recently added daily counts, looking at what's been reporting within last 24 hours from the update of the site. We have things broken down by county and a case type or status, so active, recovered, or deceased, and totals. And then some additional info here. So this would be sort of a general epic curve by week over time. You can zoom in and get daily counts also. So if you hover, you would actually get daily counts. You can see sort of what it looks like. And then last about 4 weeks or so are considered to be active cases on average. And last 2 weeks from today are still sort of, we may not get all the cases yet, right? We get things reported to us through either from state, if it gets reported to state, but not to us, doctors' offices, hospitals, labs. They're all supposed to report to the local health department and state health department. And sometimes things only get reported to us. Sometimes cases only get reported to state, and then we sort of have to get them back on the back end through reconciliation, trying to figure out if we're missing anything. So the number's a little bit fluid, and we just had a discussion about it. And we almost have, we have like weekly discussions of discrepancies between local reporting and state reporting and national reporting. And there's always going to be a fluidity. Some people report it in the morning, some people report in the afternoon, when things are entered versus the day of onset, or date of test. So there's different ways to look at it. We've stuck with this for a while now. It seems to be working well. Allows us to see kind of what the load is currently. And recently switching to this, showing you the full set of cases, as well as actively what's happening right now. So technically, yes, we had a lot of cases, but if these folks are recovered, they're not there presenting a current risk or a threat for reoccurrence of COVID. Breakdown by age groups, also active cases by age groups. So this is kind of interesting to see where shift, like in your active cases right now, we're 20 to 29. Age group has the highest number of cases in the active. So it's not the old people, it's not the super young folks at this point, it's the 20-somethings. They're actively right now infected and could be spreading this out. So additionally, just focusing on active stuff here, we sort of have a spatial density here, limited view, no zoom tools or anything like that, because trying to protect some HIPAA sensitivity here. We don't want people like digging in to the level, but you can sort of see just briefly, kind of at a high high level that, yeah, chunks of Newport here, maybe some Dayton, Newport area here, Bellevue, potentially some of the 410, 17 areas here, maybe Union are experiencing slightly different densities there. So looking at total cases, also you can hover over each of these spots and each of the centroids and get the total case rate per 100,000 population standardized. So these are standardized by size and color, right? So darker and larger circles have higher rates. And then only looking at the active, you can see it's sort of a different picture a little bit, where like 410-19 right now here, overall didn't have as many cases as maybe 410-11, but in the active case population currently, they are, having sort of a higher risk or higher case loads in the active case type population right now. And similarly, this is sort of an obvious one here. 410-11 probably had the highest number of cases so far out of our top 4 counties, so sort of a Covington area, even when standardized by population. But when you look at the active cases, they're actually 410-17, sort of suburbia of the Fort Mitchell, Edgewood, Villa Hills, Independence is kind of overtaken that as far as active. So one could argue and say that disease is sort of spreading towards suburbia more now from the urban centers overall. This data is updated daily at 4 p.m. with one push. And then I will just really quickly jump in and show you the testing site. This is standard Esri out of the box, right? Drag and drop kind of thing. We just have information here. You can grab a pin, you can drop a location, and get information close to you. In this case, change the radius or anything else. And it gives you the information of the nearby testing site, website link, that kind of information. If there's any instructions on how you can, what do you need to do, whether you need a prior doctor's note or anything like that, we try to include those here. Those are updated as soon as we have additional information. It's kind of an ongoing update. So it's not all Tableau, but we did have some. Unfortunately, some of the coolest stuff that I have, I cannot share with you because it's not HIPAA protected. So some of our internal Tableau dashboards are sort of for our eyes only at this point. And maybe after this is over, we can de-identify some of that information and sort of have a after the fact look, see what that looks like. I'm going to stop right here. I don't think I have anything else to add. I'm going to open up for any questions that you guys might have.
I don't see anything in the chat window, so if anybody has any questions, you can just unmute and talk. Well, thank you, Ned.
Okay.
Yeah. This was interesting stuff.
Thanks. It was definitely interesting for us. It was somewhat of a challenge, just using your desktop software and then having to kind of disappear and do it all remotely without having all the tools available that you have in your office. So
Google Sheets.
Yeah, it worked out really well for us. I was actually pretty pleased with the robust capability of, free.
I use it on my phone. So
right.
yeah. All right.
Okay.
Well, thanks, Ned.